pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, trustees taking a look at the minutes.
So moved.
Second. All in favor?
Aye.
Motion carried. AG1, resolution authorizing 2025 vehicle leases.
I'll make a motion.
Thank you. Second.
So
Sure.
AG1 is a resolution requesting approval to trade in 15 county vehicles, 4 of which are owned and the other 11 are leased. And we'd like to upgrade that to newer models. The overall number of vehicles in the fleet will remain the same. The decision to transition to a smaller SUV, and we did that to absorb some of the costs for trading in the county-owned vehicles. And the financial impact, the total anticipated lease costs will increase $3,480. Some of that cost is eligible for state aid Article 6 reimbursement with an estimate of $1,740. That impacts to the 25 budget.
the 4 cars that we actually own, what kind of cars are they?
They are Equinoxes,
What?
Chevy
And
Equinoxes.
how bad are they?
None of them are really bad, but what happens if you get past your 5-year mark and they're at your 5-year mark is you start running into brakes, tires.
What's the mileage, approximate mileage on those vehicles? No, they can't tell.
I think they estimate about 60,000 average.
So, the district attorney was here yesterday talking about possibly investing in something that would be suitable before we trade them in if they go up. I mean, if we own the cars already, would it make sense?
If we own them, yeah, that's possible. They can be assessed for transfer to another department. We lease another one. Well, when you lease this enterprise,
Yeah, that includes
they
the trade-in
take
on
the
the,
leases, but they are taking the trade-ins on
That's right.
our own one.
That's
Right.
right.
And that reduces our
Back
lease
number of
payment.
years.
Correct.
Yeah.
And then they would have to lease when they get the number of vehicles to maintain the fleet.
So,
I'm just wondering, would the county be able to save money and provide vehicles to other departments if we don't trade?
they have to look at how much they take off the lease, being part of that trade-in, compared to what we might save by not having to buy vehicles. But it may be part of the enterprise agreement that we have already agreed to trade these.
Is that a mandate or
I'm
is that
trying
just
to think whether they get the county one or just the ones they used to do.
They get the county off.
I understand it will offset some of the cost, I understand that, but are we losing money, basically? We need vehicles for other departments, are we trading in vehicles that could still be useful? And then have to go buy vehicles or lease new vehicles? Because I got news for you, an investigator doesn't need a price.
Right.
Transport, potentially.
We did sell a couple vehicles at PSI.
but we reduced our fleet, we did that.
But we did reduce our fleet.
Is there a time constraint to this? Like a 10% got to
They would like an answer this month so that they can get us in for orders.
Yeah, because this is for next year.
Correct.
2025. Wait a month to investigate these other things.
I'm sure we could, it just might change what vehicles are still open for orders at that point.
Yeah, because of the supply.
Right.
Why don't we wait a month? Richard?
Now, keep in mind, some of these vehicles, departments get reimbursed for the costs on their vehicles. Some departments are not going to.
Good point.
So we gotta look at that. Right now, with 60,000 miles, if that's what they are, give or take, whatever, there's good residual value for them. So I mean, that's something we gotta explore, because if you remember right, Bill, back, oh God, it had to be 10 years ago or so, we used to just let the police cars go.
Yeah.
We took them, and we found out we made more money, we did much better by selling them. A similar situation, not the same, similar. These cars won't have, I'll use an example like a investigator would brought up. Those cars are gonna idle a lot. They might not have the miles, but it's gonna have a lot of idling time. Where these won't have that much idling time.
That's what we need to know, is that if you don't trade in, say, 2 of those, what does that do to the lease costs to replace those things?
I believe it comes out to, I want to say 3,500 a year.
I mean, if we don't trade it in,
Yeah,
is there a lease cost per vehicle with a trade-in
Yeah.
versus a lease cost per vehicle without a trade-in?
yes.
That difference is what we.
Yeah, objects, right.
Yeah.
I would suggest that, we hold off on this right now, but we have a special meeting before this month's full ledge meeting, so we can get an answer, if we could get us an answer
I
by,
do have that
by next,
information,
by
so,
next Thursday.
Yeah.
I think it's next Thursday, right?
Yeah, you just gotta go there.
And then,
Too.
Yes.
Yes.
Guess they could act.
then we could, you know,
So you could pass this through contingent upon that information. So it could be changed to F&P here at the legislature.
Okay, so we're gonna hold off on that. You're gonna find out that information.
Email. So,
All in favor of that? I
I'm
guess.
lost now.
Oh, just.
You're gonna say yes to this now, contingent on F&P, or are we gonna put it on hold now?
We're gonna put this on hold. We're gonna table this.
Hang on a second, what's the best course of action before we start making this?
Yeah.
We could, you could do it either way. You could pass this now, and ask them to have this information available for F&P. If her information changes this, then we can change it at F&P. That's the full
That's
legislature.
the easiest way, that way we're done here, we don't have to have a second meeting to.
Right, either way, we're.
So we received the new
That way,
information
so
by
Thursday,
Thursday.
this month,
Right.
we need.
Right.
Okay,
That's what I was looking
they'll come at F&P on Thursday.
Right.
That information.
Yeah.
Decide that.
Right.
Take that for it. The next
So let's
one.
pass it, let's
Let this pass.
Yeah.
It'll get perfect, yeah.
And then let F&P sort it out by Thursday, right?
Yeah.
Okay, that makes sense.
Yeah,
All,
we have a special.
all in favor?
Aye.
Opposed? Carried.
All right.
Okay, HG2, resolution authorizing classification of one position, health department, motion.
So moved.
Second.
You're up.
this is a reclassification of a vacant registered nurse position in preventive EI specialist in the Children with Special Needs Division. The RN position was created with the fellows grant and was only occupied for a short period. In June of this year, the fellows grant ended. That made that position a permanent position in preventive. As you know, early intervention is a mandated program. All children eligible for early intervention service must be assigned a service coordinator. Per the standards and procedures for service coordination under the early intervention program, it states the anticipated range for caseload is between 25 and 60 families per one full-time equivalent case coordinator. As of June of this year, we currently have 2 full-time EI specialists, and they're carrying a caseload in the high 90s. The financial impact would be preventive services and FICA would be reduced to $13,468, and early intervention salaries with FICA would increase to $13,468 And this is also a downgrade per one grade, resulting in an overall savings of $1,063 for the remainder of 24, and then $3,683 for 2025, calculating using the current scale.
Save money, like saving money, classification for the position. Richard?
I got a lot of questions on this, to be honest with you. I remember it wasn't that long ago, we were having a heck of a time getting RNs.
That's correct.
And, we, all of a sudden, we don't have a need for RNs, that's what you're saying.
No, the need's still there, we're just not doing what.
Are we supposed to be doing something?
No.
That's not?
No, everything is covered. Everything we're supposed to be doing here.
Okay, now, what is causing
Early intervention.
early intervention? Because I read through this thing and, developmentally delayed and disabled children. Why are we getting an increase in the number of those in these counties? Is something in the water, or are we having people more different diseases? What is causing this? I mean, that'd be a good thing to find out.
That would be a great thing. What the cause is. But the numbers have increased close to exponentially over the last couple of years. Early intervention, children are qualifying sooner. And at like 17 months, they're qualifying for these services. That was unheard of even 2 years ago. And we evaluated 107 so far this year, and 61 of them qualified for our services. As compared to 2023, only 41% qualified for services. And in 22, only 37 qualified for services. So we are seeing an increase. The diagnoses are way more complicated. That's the answer. The why,
You know,
I wish I,
Vera, who determines whether they're qualified?
our service plan,
Those come from referrals
they come from referrals all over.
from,
School districts, they could be school districts, our healthy families, our MCH program. Any child in this county can have a referral to EX services for an evaluation.
so it may be a case of increased referrals.
It absolutely is increased referrals also, because they're seeing it.
All right, do you know if the referrals are increasing from our own program or from the school districts? Is that something?
If arts are increasing, the school districts are.
but you said, helping with, maybe I misunderstood. They're coming in as early as 17 months.
That's correct.
Their school hasn't touched them yet.
Right, but their referrals are based on the school districts. Say that correctly, Jen?
I don't know anything about the
So,
Are we the only ones having this problem?
no,
And the state haven't put any money or study into this, why this is happening? I mean, I would think they'd be alarmed.
I would hope so.
Underages?
They are younger.
So people are making diagnoses and have them checked further,
Right,
what they're saying.
that's correct.
So did they change that procedure
No,
in the states?
they have,
Regardless of, I'm sorry, regardless of the number of referrals that you get, though, you're assessing these referrals to determine whether or not
they qualify.
they qualify for
Yeah.
and so it doesn't really make a difference who you refer. It makes a difference how many actually qualify for the service.
Right, and that's why the percentage is like 61% are qualifying for, 61% is qualifying for our services.
So 61 out of 100 kids that come in qualify for.
That's correct, so far this year.
And how many kids total do we have? No, I'm just
No,
curious
that's
as to like the
okay.
overall volume of this, you know,
Right.
how far, I mean, 61 kids in a county is not that many, but if it's 6,000 kids in the county, then it's significant.
Right. It's just referrals for this one program. And then we keep them in something. So how long we keep them also increases the number of families in. So we can have them at 17 months, and then we keep them until they go to preschool or elementary school.
Understood. And are we following up? Sorry. Are we following up to see if this program is having any significant improvement in these children? Seeing any success, or is there any?
No, there's absolutely nothing.
So are we seeing any kind of success?
I can get those
Intervening
numbers.
early?
And then
I guess that's the question, right?
Yes.
I mean, is this program working? Or identifying more and more kids that need early intervention? Is that having an effect as opposed to kids for milk?
I would say yes, but I.
That's what you say, right? Yeah.
Could this be related to after COVID, both parents going back to work and kids are going to daycares where they're being looked at, trying to, it's amazing what a young child's going through daycare. I see this with my granddaughter. And it's amazing how much they're watching her and picking things up or not. Maybe they're doing referrals too.
Absolutely, they are.
Yeah.
That's the thing.
This requires a four-year degree in psychology, sociology, social work, human services, or closely related field. Correct? Four-year degree? Or what is your projected success rate of $43,000 for a four-year degree? That's not much money.
Should I have someone hired? I think we'll hire someone.
You have somebody lined up?
I do not, we do not have someone lined up, but I believe we should be able to hire. Early intervention specialist, preschool nurse, pretty.
Very good. I think, listening to this is, it's great to have these, services available. These kids, the sad part is the number of, kids that are out there that don't get these services. That that they're out there. I have no idea what's going to happen with that. Hopefully you have any other questions.
So you definitely have to find out why.
Yeah,
Because
why? I think part of it is to break down the weakness of a traditional family unit at home. Things start at home. A lot of things that Jay said through COVID, parents are split, going everywhere. They're putting daycare under the care of other people in their supervision. They don't know what's happening right there exactly. Then they go home to a family that they're so busy and everything today, they don't know what's happening. Just don't know.
Don't raise their kids.
Correct.
Let's be real.
Correct. That's just where it boils down.
There's more one-income families than you agree. I mean, when you've got kids you're raising, both parents are working. It's just very difficult to raise a family of three on one income. So that's why you see both parents out there working. I don't blame parents. I just think they're being looked at more scrutinized at these daycares more than they ever. So I think it's a good thing because you're getting help where they may need it, but I don't know that it's fault back to parents.
No, we don't know.
I know.
We haven't got
That's
any
big
answers.
assumptions, right?
We don't know. That's the bottom line. The state should be looking at this, giving us feedback.
And we are getting more referrals from our health families department, which is definitely getting children early. So,
Any other questions? All in favor?
All right.
Opposed? Carried. That's it. Did you have any, there's nothing listed as, but you have things to share about the,
just real quick, on, department received confirmation that one pool of mosquitoes collected in the field station in Western Road tested positive for EEE, Eastern equine encephalitis, along with two other pools that tested positive for West Nile virus. These pools were collected on 7/24. A request was made to Dr. James McDonald, the Commissioner of Health, to designate an imminent threat to public health for Oswego County, and on the August 2nd, that was on July 30th, we received a report that a horse went down in Richland and were sent out to test. And on August 2nd, again, the results did come back for a positive West Nile virus. The reason we believe is that the horse was not fully vaccinated. We are waiting for last week's results to come in. We did send in 49 mosquito pools. We have taken the steps to do aerial spraying. The plan is to, when everything is lined up, that we will conduct aerial spraying. It could be as early as Thursday, weather permitting, or into next week. So everything's in place. We just have to last your signature.
So I raised my hand, I signed that yesterday, so you should be all set.
Thank you very much. I'll grab a copy of that. Thank you. So through the month of June and July, we did distribute 48 cases of mosquito dunks, including the delivery to 18 town halls. Want me to keep going? A couple more things and then I'll cut it forward. Rabies clinic was held in West Monroe. On June 12th, we vaccinated 131 pets, 99 dogs, and 32 cats. In Hannibal, on the 17th, July 17th, we vaccinated 204 pets, 164 dogs, and 36 cats. Our next clinic is going to be held tomorrow, right at Bristol Hill in Fulton. Harbor Fest, just real quick. 44 food vendors were inspected, one found without proper permit. We did work with them and they were able to operate without issue. 10 other vendors did have critical violations, mostly hot and cold food handling or holding violations, we call it. Most violations could be corrected immediately. One vendor did have to throw away almost 100 pounds of meat that was out of temperature. Others were much smaller quantities. Super Dirt Week plans are underway. Our public health and safety team, I'll do a quick report on that. Here's our numbers.
Sure. Can I just ask you, going back to the rabies clinic,
Sure.
I know we moved one to the Fulton Memorial this year. How did that go? Did you get a good turnout?
They had an excellent work.
Okay, good.
Yep, that was our
Yeah,
best.
I was at that clinic and that was fantastic. The setup was superb. Just one change in the parking, just need better signage. So
Right. And
all
then
the workers, they enjoyed the facility. It worked well for everyone.
we did, it was really good. It was well
Good. Glad
attended.
to hear.
Just go back to Harbor Festival. Well,
Sure.
question, is there an issue with the water supply at Great Back Park? Something that had to be remedied with equipment or something related to the city?
I did not hear of that.
Okay. Is that something you could look into?
Thank
Thank you. There
We
was,
can check water supply.
there were rumblings that the county had intervened and some aspect of the equipment at Bright Back and required, they had to make some quick purchases to remedy that. So I'm just checking the validity of that.
Okay, I know
Go right
that-
to the source instead of
Yeah.
listening to the rumors. So.
I'm sure I would have heard that.
But that's, I would think so, but
Just in case, I will.
Okay,
look
thank you.
into
I
it and make
appreciate
sure
that.
I get right
Yeah.
back to you on that. Our cross-sector public health and safety team continues to meet. We are implementing an overdose fatality review team and continue to train and distribute naloxone and test strips throughout the community. In the second quarter, we trained 214 people in naloxone administration and 25 training sessions took place. We also distributed 288 naloxone kits. Our distribution of naloxone in 23 to 24 represents an increase of over 200%. That number is expected to rise as distribution continues through the remainder of this year. In partnership with the Sheriff's Office, Naloxone is now being provided to all individuals being released from OCJ, and that started on August 1st. Lastly, we continue to meet and collaborate with key stakeholders to spearhead new initiatives to address gaps in the community.
I'm looking at your numbers and it looks like year to date, we're down quite a bit, right?
Yeah.
Fatalities went from 16 last year to 5 this year for the same time. 230 overdoses, 157. It's, we're working and going in the right direction.
We are going.
Very good.
Raising Rock program, Seattle County just started theirs a couple days ago. Are we gonna get any part of that?
We are included in that. So, the oral rabies drop program is actually over now, but we were part of it. It was mostly in our northern part of the county where that took place. There was a map online and we put out a press release of where they were dropping the oral rabies. But pretty exciting stuff. I'm glad they continue to pick us for the county. It's like,
Got much more on my barn.
I know.
About 50 grand extra.
me too, dropping right over my house.
Have any other questions? And I'm looking for the appropriate motion. All in favor? Aye. Let's go.